Hello, this is Dr. James Legbele. Welcome to this program today. And our topic today is 10 myths about health and well-being. And it's presented by me. I am James Legbele. I am a consultant in the UK for a number of years. These are my degrees. I'm a member of the Fellow College of Physicians. And also being a senior doctors. I am the founder of the six domains of health, and this is my website. If you could connect with us at 6dofhealth.com or 6dofhealth.net. The objective for today's presentation is about what is the reason for myth and applying the six domains of health to identify a number of myths and then learning from 10 myths and then harmful myth to your health. And so many people have adopted myth either because they heard from colleagues or friends, or perhaps they have heard from um, healthcare professionals without without taking everything into consideration. Let's go down to the 10 myth without wasting time today. The first one will be around physical health. The number one myth that we'll be looking at is drinking plenty of water a day. In my practice, I've seen many patients coming to hospital either because they are dehydrated or they go to the extreme end of drinking too plenty of water because they've been told that they should drink plenty of water a day. Drinking plenty of water a day might be wrong advice because of the confusion around amount or quantity that somebody has to drink every day. As you know, different people have different daily requirement, and intake about 4 liter a day can be very toxic because it can lead to water intoxication, what we call water overload. The second myth is around also physical health, which is um, advised to take low fat is always healthier for you. Although this advice might seems a very common advice, but we need to be a little bit specific because when it comes to fat, we have saturated and unsaturated fat. You really want to be avoiding too much of saturated fat in your food, and that is the reason why it is advisable that, according to UK guidelines, recommend that average man should eat no more than 30 grams saturated fat a day, and every woman should eat no more than 20 grams of saturated fat a day. It is also recommended that people should reduce their overall fat intake and replace saturated fat with some unsaturated fat. The third myth that we'll be looking at around physical health is coffee is bad for your health. As you know that sometimes certain things in moderation is good, or anything in excess can be very bad. Drinking coffee can be beneficial for your health. However, too much of coffee can influence conditions such as insomnia, which is inability to sleep at night, headache, or some people have urinary frequency, and as well as effect of coffee on the heart or other cardiovascular system. Some people might have palpitations because the heart is racing very fast. Drinking coffee may be linked to a lower risk of the conditions such as Parkinson's disease, type 2 diabetes, and dementia, the Alzheimer type. And then there are certain metabolic syndromes that are protective, and as well as chronic kidney disease and liver cancer, as well as liver disease. The fourth myth is around do not take salt in your food. For healthy adult, we do recommend daily insult intake not to be more than 6 grams because of the risks of hypertension and other disease or increased cardiovascular disease and heart failure. So, not taking salt at all can be very bad because we've seen patients coming in with what we call hyponatremia, in which case sodium is very low in the blood, and then patient came in with falls and sometimes confusion, and then inability to walk properly, and then predisposing them to risks of seizures if the sodium become very low. The fifth myth is around a little cocktail out there can stop or cure dementia. As you know, there are so many factors that may make someone to be prone to dementia. The exact underlying cause of dementia is not known, although we do know that there are various types of dementia. Some are reversible causes, some are not. Drinking cocktail has shown might shown to be um, able to moderate certain symptoms of dementia, but it shouldn't be a cure for dementia. Those who drink more than also alcohol, 14 units per week, may also have increased risks of alcohol related dementia. What about family health? I've chosen this myth, which is number six. Family violence are only seen among men with alcohol, sex, drugs, or and stress. Might not be the case. There may be factors if you are having family breakdown with your wife or your spouse. You have to understand that there might be a reason behind that, and I will strictly advise that you seek marital counseling or seek alternative way of resolving conflict within your family. Family violence are not only seen among men with alcohol or sex, drugs, stress. Other factors can influence aggression in the family. What about mate number seven? So we've taken one around social health. Social isolation and loneliness have no effect on health. And this statement might be very bad because these are uh, social determinant of health. A lot of studies has been done around social isolation as well as loneliness, and they are can make someone prone to diseases, especially social determinant of health been widely studied, and we do know that social isolation and loneliness are social determinant of health. So let's look at another myth around emotional health. So as I wrote in my book, I call the six domains of health on Amazon, you can find that we do have negative and positive emotions. And if the statement says some emotions are stupid, this is one of the common myths about emotions that can really stiffen you. Believing any emotion is stupid, especially the emotion that make you feel vulnerable such as shame, sadness, or fear, is a way of invalidating yourself and your own experience. As you can see, that one of the acceptable framework for controlling emotion is emotional intelligence. I will advise that you look at it. So let's look at one myth on mental health. Mental health issues are a result of personality weakness or character flaws. This might be not true. Mental health problems are complex and often arise from a combination of biological, psychological, and social factors, including genetics traumatic experiences, stress, and environmental conditions. Sometimes we may not be able to know the exact cause for the most influencing factors for mental health. But if you do have mental health, you need to seek counseling or seek mental health advice. The final one today is around spiritual health, which is our number 10. Uh, let's look at this one. To be spiritually minded, you must be vegan and avoid alcohol. As you know, there are new area of health which we call spirituality of health. Uh, many aspects of what you see online may be correct, or some of them might not be fully correct. Having understanding of spirituality and having understanding of how our environment and spirituality can affect our health is so crucial. To be spiritually minded means being attuned to spiritual realities and ability to discern spiritual activities in your sphere, especially those emanating from realm of the spirit. You do not need to be vegan and or avoid alcohol before you are spiritually minded. So understanding that we living in a world which is controlled spiritually might be beneficial for you to have a spiritual cognizance. So, and also to have spiritual discernment as well as spiritual intelligence. This is the end of my talk today about the 10 myth. And as you know, we have a YouTube channel, which is the six domains of health. And we also have our website where you can see our information product and books, as well as courses. We just launched a new course on the six domains of health, which is very crucial for anyone who wants to attain health, because oftentimes people maintain physical health and then ignoring the other domains of health. As you can see, if you are doing just maintaining your health through exercise and diet, you are only doing one out of six domains of health. So, therefore, a very crucial knowledge of these six domains of health will help you to be adaptable and to be able to confront any health challenges that you face rather than waiting and then rather being frustrated when you have seen doctors. It is your responsibility to be healthy and strong. And I see you again very soon. Take care and bye for now. Bye.